My name is Sam Hargreaves and I'm an obstetrician gynaecologist here at Epworth Freemasons. I've been here since 2008, which is a long time. I also practice at the Women's Hospital. The first few days, when you look back on it, will be a bit of a blur and a whirlwind, and it can be quite overwhelming on frequent occasions. You'll be quite sleep deprived depending on what sort of labour or birth you've had, and you'll also be up feeding your baby regularly throughout the night, so you will feel very tired. You also might be quite sore, and you might find it's quite uncomfortable just to move around. You'll be offered medication to take, and I would encourage you to take it regularly. There's simple pain relief, which is often surprisingly effective, but of course there's stronger pain relief if you require it. Ice will be your absolute best friend, and it might sound bizarre, but you get to sit on some ice, and I would encourage you to do so. There's no doubt that going into your pregnancy as a fit and healthy person will really help your recovery. Labour is, after all, a physical process, and so fitness is going to very much help you. It's important, I guess, to maintain some fitness afterwards. Gentle exercises, yoga, Pilates, stretching can be really valuable, and I would encourage you, when time permits, to keep going with those sorts of activities. You may go home with some pain relief, and you might not take it all, but at least it's there if you need it. And as much rest as possible. Obviously you have to care for your baby and for yourself and perhaps other children you have, but there's no doubt that getting your feet up, if you can at all through the day, is going to be helpful. There's also some very useful garments out there, bike shorts and supportive tights, that can often help recovery in terms of giving your abdominal wall a support as well as your perineum. There is a surprisingly large amount of help available. Obviously there's family and friends, and hopefully you have those available to you here in Melbourne, but not everybody does. In a practice such as mine, we have a midwife who works with us, and she's someone who you can call at all times for breastfeeding advice or just general advice about the care of your newborn. There's someone called a maternal and child health nurse who's provided by your council, and you'll be offered visits with this particular nurse, and she'll do things like weigh your baby and just check how you're going. Your GP may be a very valuable resource as well, depending on the relationship that exists with them. There's also a number of telephone hotlines that are available both for breastfeeding support or general care of your baby. These will be provided to you when you're discharged from hospital. You should see your obstetrician 6 weeks after your baby is born, but certainly in my practice, because of the availability of my midwife, sometimes she'll suggest an earlier appointment depending on what's happening in your particular situation. You should ring and make that as soon as you leave hospital, because you'll forget, you'll be busy.